Hello, Dr. Charles Nivens here. Today we're just talking about when to see a doctor. Obviously nobody likes to see a doctor. If you can avoid it, most people will. I'm a spine physician dealing with acute and chronic spine disorders, and mainly that includes pain. So, when do we go and see a doctor for pain complaints? If you're not doing the things that you really enjoy doing, that's when you really should be seeing a doctor. And that could be golf, tennis, pickleball, going out for a walk, walking your dog, making long meals if you used to like to do that, and those kind of things cause you a lot of discomfort. That's when you should come and see a doctor, just have it checked out. Whether this requires any treatment or not, sometimes it doesn't. Sometimes it's medication, sometimes it's therapy, and sometimes it's interventional procedures that will help mitigate some of that pain. So again, when you want to see somebody is when you feel like you want to increase your ability to do the things you love to do. And there are a lot of options out there. The first thing is just doing a good exam of the patient. So, when you come to see a specialist like myself for spine and musculoskeletal medicine, we're going to do a thorough history and physical, probably take some x-rays, and most likely leading to an MRI or CT scan. And that will help us just identify what the problem is, and then we can talk about what the treatment options are. We recommend you do this sooner than later. Pain can be interesting. Acute pain can become chronic pain, which means 6 months or longer. And the problem with that is a lot of times pain is harder to treat if it's been there for some time. There's these engrams, these pathways that go from the area that we're having pain to the brain. And if it goes on long enough, that pathway is a well-established part of our neural system, and that can be more difficult to treat. So we always recommend evaluation and possible treatment early on. The obvious things when you really want to go and see a doctor is if you're having persistent numbness, or numbness that's happening more often than it should, or even you notice that you're tripping more. It's so funny, a lot of my older patients will think that they're just getting clumsy because they've gotten older, and most of the time it's not that. They're tripping because they're weak, and sometimes it's a subtle weakness. Bowel or bladder changes, that can be caused from the spine, and so that should be evaluated by a physician just to see if there is anything to it that could be remedied. And again, early prevention is always the better scenario. Getting on top of it and trying to treat it before it becomes more of a hindrance in your life and your world starts shrinking. We recommend doing something about it, being proactive and getting yourself back into your life. I'm not a big medication person, and what I find is a lot of people start taking a lot of medications that just to help reduce their pain, but unfortunately all of these things have side effects and long-term effects. So, my goal is to not put my patients on a lot of medications. My goal is typically to try to get the pain under control where you do not have to require medications all the time. Certainly I use medications myself when I need them, for my patients when they need them, but I'm anxiously getting them off and myself off as soon as I can. As far as the treatment, that's difficult to say until we do the full workup and the physical exam. And typically we're able to isolate the exact etiology of the pain, the cause of the pain, and therefore the treatment. What I find is a lot of patients have vague complaints and they'll see a physician of some sort, and nobody really kind of knows what's going on if they're not presenting as obvious as a lot of other patients do as far as spine disorders. And so, if it's something that's that you've been told that, well, this is something you have to live with, or something that's part of your aging process, that may be true. But if you find that you're getting frustrated with that type of explanation, then that's where possibly a specialist can come in and help with that type of diagnosis and possible treatment.